Oh, okay. We wanted to go ahead and check in with each of you to see how things are going. So on last month's call, we talked about some of the steps that you all could get started on in preparing. Janet gave us lots of good tips on things you could be doing in the meantime while we're in kind of a lull due to COVID-19. So hopefully some of you were able to get started on some of those things and building partnerships in your own community. I know Janet had a chance to talk with many of you recently about how you were all doing and your plans for coming up. And last month, Dr. Neri talked about how ADHS would like all the counties to come up with a 6-month plan for this program. So thinking about when or if you might be able to start holding your groups, what you can be doing in the meantime. So we're going to go ahead and go around and just have each of you kind of tell us about how things are going, where you're at with that 6-month plan, and what you're thinking for the coming months. So why don't I just kind of go down the list that I have here. So first I have La Paz. Mandy and Leanne, do you want to tell us about where you're at?
Hey, this is Leanne. So we are ready to have our next class. We were ready before COVID hit, and we're just waiting for our community to, at this point, give us the go-ahead to be able to gather, to have the class. The other issue is really the senior centers are totally closed down. So we're kind of waiting on that as well. One thing that, because we weren't able to have one in the spring, one thing that Mandy and I have discussed is having two, once we're able to start having one here in Parker, and then also having one in Quartzsite instead of waiting to finish one before we start the next. So we're
great.
Yeah, we're wanting to be able to offer it to both communities.
Yeah, that's great. So have you already promoted it in Quartzsite as well? Like, do you have a group of people who are ready?
Well, we have a list. We have not actively promoted it since COVID started, but we were promoting it before. So yeah.
Okay, thanks, Leanne.
Yeah, you're welcome.
Next I have Maricopa, Lori, and Yasmin.
Hi, is Yasmin on the phone?
I think I saw her.
Oh, well, if she's not there, or she can jump in. I think Yasmin also has been reassigned in some other areas, but we have been identifying monies and budgets. Our plan is to have a class completed by December 31st, and have that probably taught by CHWs. We are really just kind of waiting, I think, for a few things to open up a little bit more. We are very interested in the online portion that's being developed. I talked to Janet Richards about that, since it has been it's of the virtual. It's almost all virtual already, but this would be an in-person one. So that's really kind of our plans. We have talked about it being in Spanish. We're just going to have to see, but that's where we are.
Great, thank you, Lori. Next I have Irene from Apache. I know you were the one county who was kind of midway in your group when COVID hit. So what have you been thinking about, Irene?
So good morning, everyone. So I talked to Janet last week, and I called the participants that we had. We had a small group. It was 5 people, and they're all okay with restarting classes. Sarah and I just discussed it yesterday. I was hoping that we could start like in a couple of weeks, but then with 4th of July coming, we figured we would just wait till the following week or the second week in July to get started. And it seems like everybody that was with us will be able to restart again, and Janet had recommended for us to do the videos of session 1 and 2 because that's all we had done, and then start classes up again.
Great, that's great news, Irene. I'm glad you'll be able to get started again.
Me too.
And the location you were meeting at is okay to meet in still?
So yeah, I was waiting to see if our conference room was going to be open, and I got the go-ahead with that, so that's where we're planning to meet.
Irene,
Good.
Irene, this is Janet. That's great news. So let's make sure we touch base this week or next week.
Okay, thank you.
Okay, great.
Okay, next I have Coconino, Brian, and Candace. I see you on.
Hi, this is Candace. I don't know if Brian has anything to add, but we had been in the beginning stages of planning before COVID hit. We were speaking with our adult center and Flagstaff to try to set up a series of dates that we could hold the class. And then Brian was working to try to get something set up in Page. And unfortunately, with everybody, most of my staff has been heavily involved in the COVID response. So we haven't had much of an opportunity to do planning. We have been thinking about the possibility of hosting online Zoom or some other platform meetings for these, but I think that we'll have to see. We'll have to see what technology is like. I am working with our Alzheimer's Coalition to host some unrelated webinars that will hopefully serve as a test, a test run for how people are able to engage on that platform. So if they go well, then maybe we can consider doing this program online as well.
Yeah, that's a good idea to have that as kind of a test run and see how it goes with that population. Okay, well, keep us posted. I hope your webinars go well.
Thank you.
All right, next I have Yavapai. Rachel, how are things going with you?
Sorry, I had to step away for a minute. Are we just sharing updates about what we're doing with Finding Meaning at Home?
Yeah, just updates on how your planning is going, what kind of your 6-month plan is.
Okay, so we had reached out to Janet Richards with Duet and just kind of talking with her. We were thinking that with our area, just because we do have a high population of older adults, that it might they might be more nervous to come to an in-person workshop. And so we've been talking to her about seeing and trying to do something virtually and maybe even just getting together and hearing from a group that has done a video conference or a phone call already, just so we can hear from them and their lessons learned. So that's where we are.
Okay, great. Thank you, Rachel. Next I have Penel, Veena. Veena, if you're talking, you're muted. We can't hear you. Okay, we'll come back. Maybe she had to step away. How about Nicole and Greenlee? Nicole? Okay, well, is there anybody else I missed? Oh, I see. Rena's having trouble unmuting. Let me see if I can unmute you, Rena. I think I can. Whoops. That's not what I wanted to do. Let's see. And Nicole too. Okay, I'm trying to figure out how to unmute, ladies. 1 minute.
Ms. Leonards, I don't think we can unmute from our side. That's one of the challenges with Google Meet.
Yeah, I think I can mute people, but I don't think I can unmute you if you have yourself muted.
She sent a message. So I'll message back, but yeah, they would have to either, if you're calling, you need to dial *6 to unmute, and by the same token, *6 to mute yourself. Try that. Also, but if you're just joining online, it's on your end. We cannot mute, we cannot unmute you. You can mute, but we cannot unmute you.
Yeah. Okay.
This is Raina. Can you guys hear me?
There you are, Raina. Yes, we can hear you.
I'm actually on my phone, so I'm down. My computer's upstairs because I didn't want it to echo. So I'll go back up. So my update for Finding Meaning and Hope, we were going to start a workshop before COVID hit. And the great thing, I am partnering up with Pinal Gila Council for Senior Citizens, and they already have caregiver support groups. So we were already advertising to them, and we sent out the flyer. So once everything opens up and we're able to do workshops, I think we'll be able to tap into the caregivers. And they have them in all our small cities. So they have one in Casa Grande, one in Maricopa, in Coolidge, and all of that. So I feel like once they open, we are able to teach in person, then we should be able to teach right away.
Raina.
Okay, great. Yes.
I'm sorry, Tracy. Raina, I want to Janet. I talked to Jan last week. Are you guys interested in doing a virtual session, or are you going to hold off until that face-to-face? I'm sorry, I can't hear whoever was asking.
It's hard to hear you, Janet, but I think what she's asking, Raina, is she said she talked to Jan, and she's wondering if you're interested in the virtual option or if you're going to wait until you can do the in-person one.
So I'll have to talk to to Pinal Gila. I know we're currently doing an online workshop right now, so we might be able to do it after, but I'll have to talk to her to see what the plans are for after finishing up this workshop.
Okay, so let me know. Either one
okay.
is fine. And I was talking to Dan, but you can talk to Ginger and Mary, and then let me know what you guys come up with.
I'm sorry, did she say to let her know what we were going to do? I can't hear.
Yeah. It's hard to hear you, Janet. Sorry. Yeah, she said once you talk to Ginger, let her know what you come up with.
Okay, I will do that.
Okay, thank you.
This is Laurie. This is Laurie Thomas, Maricopa County.
Yes.
Can I have you clarify who is producing an online or virtual class at this time? Was it an individual county, or was it Duet? Did I hear someone saying that that's what they were going to do, but they were a county? I was just wondering where they were getting the material, and were they producing it themselves?
Yeah, good question, Laurie. So this is something on Duet's radar for sure, and something they plan to be working on. I don't know, Anne or Kathy or Janet, do you want, maybe not Janet because it's hard to hear you.
We're
maybe
dialing
Kathy or
in.
Ann? Okay.
We're going to dial in.
Okay, maybe do any of you want to talk a little bit about your plans to work on that virtual option?
Sure. Can you hear me now? I'm in front
Yes,
of, or
yes.
okay. Well, then I'll
Yeah.
just push Ann out of the way and hog the computer.
Okay.
Yes. So thank you all for your updates. It was good to connect with almost all of you last week. So it sounds like there's a lot of people that want a virtual session, and I am actually testing one out for Duet starting in July, and trying to see where we have some issues and some suggestions for overcoming them. And then I'd like to let all of you know, and we're hoping to have something ready by October, but that doesn't mean we couldn't start planning right now, picking your dates, because already it's, we're almost into July. So picking your dates and advertising it, I had sent you all a generic flyer, but you can talk about dates, and I can send you dates where you have specific dates and times, and give yourself 6 weeks to advertise. We'd fall right into that time frame when I should have a list of kind of what works, what doesn't work, and how to change the program to make it work as best as it can.
And Ms. Lennis, may I piggyback on Ms. Richards' comments?
Yes, please.
So last month we discussed, and as I mentioned, I did include in feedback to your respective counties on your IGA plans and reports, your Q3 reports. We would appreciate you starting to plan for the next 6 months. Let's assume that we are not going to be able to hold in-person meetings. What will you do? And if you are going to hold in-person meetings, again, what type of space do you need? What types of accommodations do you need to follow CDC guidelines? What does your local policy and community needs are? Keep those community-centric needs in mind, planning for the next 6 months. Whether it's virtual, in person, or a modified hybrid, please be planning about that rather than waiting to see when we're going to have in-person meetings. That's my recommendation to you.
When you roll out a flyer, you could also talk to the people that are interested and see if they do have the virtual capability, if you're planning in person. And then if it, for some reason, you choose your dates, it doesn't work, you would know which of those folks could meet virtually. But at least you have your dates and times set aside. That might work.
Great, thank you both. Does that answer your question, Lori?
Yes, I actually thought I heard that there was a county that was going to do it virtually, and I thought maybe they had already put together a virtual presentation. So I think what I heard you saying was that Janet was going to be putting that together in July and kind of piloting that.
Yes, and hopefully it'll be ready this fall for you all to use if you choose to go that route. And I think a couple of the counties talked about that, planning on that, but they'll be kind of waiting along with you for that. I know Candace and Coconino mentioned that they have some unrelated webinars they're doing with their Alzheimer's Association, and she thought that would be a good way to just kind of test out whether the technology is okay for that population and if it's going to be practical and feasible to do Finding Meaning and Hope online with their population.
And I don't know if Nicole is on the call. Yes, Nicole, you're on the call. You mentioned to me that might not be an option for you all, the virtual, because of your community, that not many people are set up to do that. So that was one that wasn't, but a lot of the rest seem that they're ready or willing to do a virtual option.
Yeah. Well, thank you, Janet, and others from Duet for testing that out and getting it ready for everybody, so everybody has, options as we progress through this.
This is Candace. I was gonna say that just mentioning the workshops that we have coming up, as you said, they're not for finding meaning and hope. But we are doing one on June 23rd. That is it's basically just geared towards helping provide people resources, caregivers, and resources during isolation, and then talking about what kinds of things and activities we can do with people with dementia. And I'd be happy to share the link to that if anybody in the state is interested. It will be on Zoom.
Yeah, that would be great. Candace, if you want to send it to me, I can get it out to the rest of the group.
Okay, I can do that. Thanks.
Thank you. Okay, so Nicole, are you unmuted yet or no?
Can you guys hear me?
Yes.
You can? Okay.
Yeah.
So, prior to all this stuff happening, I was kind of putting out fillers and seeing, the response we would have if we would have enough people to be interested in this. I was talking with like our CEGO, who goes into homes and other people in the community, just seeing the need for it and how many people we could get together. And then all of this stuff happened. I know that Janet had said about the virtual trainings or, the virtual finding meaning and hope. I don't know that, people here are set up for that, or that they understand, or that they have access to that. But I know she said about putting out a flyer just to see the response. So that might be a good idea, just to put the filler out there and see and talk to people who may be interested and see if they have the capability, especially since Dr. Nairi is saying, for us to think of a 6-month plan. So I'll definitely send you an email, Janet, and maybe we can make a flyer that has maybe some generic information, or maybe a later date, and I can just reach out to those people if they contact me and see if they have the capability, just to prepare, because I think the elderly here are a little bit afraid of actually, interacting with others and going out because of their health concerns with COVID. Our numbers are still pretty low, but our county next to us, their numbers are going up, and I'm sure there's going to be a surge in our numbers. We're just way behind everyone else.
Thank you, Ms. Verdugo.
Yeah, thank you.
And that's understandable.
Thank you. Okay, and I saw Alexandra join from Cochise. Alexandra, we were just kind of going around and talking about each county 6-month plan and where they're at. Do you want to share an update?
Yes, hi, good morning, everyone. So currently I'm working on, I'm playing catch up. I just came back from maternity leave just last month. So I'm playing catch up, just reaching out to the participants and getting their responses for the surveys. So I've been working on that, and I'm set to meet with Suzanne tomorrow to just go over some more plans to create a 6-month plan. I have been pulled into COVID-19 related duties. So unfortunately, they have us pretty busy. Our numbers are increasing rapidly here in Cochise County. So I've been pretty busy with that, but I'm trying to manage both. And as soon as we have a plan, I'll probably have a better update for next month.
Welcome back, Ms. Welcome back, and it's good to hear your voice. Hope all went well.
Thank you, Dr. Nairi. It did.
Thanks, Alexandra. Okay, is anybody else on that I missed? I'll take that as a no. So thank you all for giving us your updates and working through this kind of unique and strange time with us. next on our agenda, we had updates from ADHS and DeWitt. I know you both kind of talked a little bit already about the virtual options and the 6-month plan. Do any of you have anything else you wanted to share with the group?
Ms. Leonard, this is Bobak. I just wanted to make sure there were some callers and some private callers. Did we miss anyone? Any of our county partners? Okay, guess not. So I don't have anything else to share. Again, we are here. Other than I'm here, we are here. If you have any questions, if you want to bounce things off of us, if you'd like ideas, any type of support that you need, please don't hesitate. Just an email or a phone call away.
Thank you. Anne and Kathy and Janet, did you have anything else to add?
This is Janet again. Well, I can resend. So last month, the end of May, I went ahead and sent you all a generic flyer. So I can resend that, and I also sent you some questions so that if people call in, you could ask them, what works better for them, virtual or in person. So I'll resend that again today for those of you that may have missed that, and then that's the flyer that you can use to see about the interest in your various counties. That's it. Anne, did you have anything you wanted?
I would just add that I think we could safely say that while we really love person-to-person meetings the most, that the virtual Finding Meaning and Hope will be a very good option. We actually have had a couple of facilitators not associated with county health departments who tried it to finish up a group that had started, and in another situation where the individuals really needed it and they lived 90 miles away in a very remote area. And the facilitators and the participants loved it. So keep that in mind. And the only other thing I would add is that working with a nonprofit that serves the elder community, we find oftentimes, even with older adults in their 80s or beyond, that if they're introduced to how to connect with through Zoom, participate using a tablet, once they're shown that, it really opens up a world beyond, that helps them to navigate isolation much better. So I would just encourage you to kind of think about that while they may not be comfortable with it, if you're having a small group and you had the opportunity to teach them how to do that, you might find that not only are you really helping to combat the negative effects of isolation for them, but giving them a tool that will help them connect with family, down the road. And so those are just a few thoughts I wanted to add. We're excited to be working on this.
Great. Yes, thank you, Anne.
You're welcome.
Okay, so next I wanted to talk a little bit about the follow-up surveys. As you'll recall from our evaluation webinar and the training, we want to have 3-month, 6-month, and 12-month surveys after the completion of the class. And what I did is I went ahead and put that survey on SurveyMonkey. So you all have the link in the evaluation materials. And when it gets closer, once you all start having classes again and we're nearing the time where you would actually need that, I'll resend it out to you all. Don't worry about that. But basically the survey is on SurveyMonkey so that when you're 3 months post the end of your class, you can call the participants and just do the survey verbally with them. And as you're talking to them, enter their responses into that SurveyMonkey, hit submit, and then the data will come to me so that you don't have to be scanning papers and all that jazz. Mm-hmm. You'll still have to scan the papers for the pre and post survey in the class because of course the participants are filling those out in the class. That's something we'll have to think about with the virtual option about how we would do those surveys. And so that will be on my to-do list to kind of think through. Maybe that's something we can talk through in one of the coming webinars. But anyways, we had our 3 counties who already did a class, La Paz, Yavapai, and Cochise, and so they all have been working on those post-program follow-up surveys with their participants. And theirs was slightly different because they had a different version of a survey when they did their classes, and we've since changed the survey a bit. So their follow-up survey was kind of a hybrid of both of those pre and post survey types. So it's a tad bit longer, but hopefully not too bad. And so I have seen several of those come in from each of the counties. And so I wanted to give them a chance just to talk to us about how it went, if there's anything about the process that could be more efficient, or any tips, any suggestions. So any one of you want to start?
Hi, Tracy. This is Alex. So again, I've been playing catch up. I've been doing the 3-month one, which I should have done in February, but that's when I went out. And I've gotten some good responses from a couple. They've been the ones that were more engaged in the meeting, in the program themselves. So I expected a response from them. But I have had a little bit of trouble just reaching out to the other ones. I'm just reaching out by email. So I'm gonna try a phone call just to see if maybe they'd be more responsive to that. But with the email, I had been emailing them and then just setting up a day and a time to speak with them that was convenient for them, because obviously they have appointments or they have their own routines. So that was working really well for the couple that I got. But I wanted also to ask La Paz and Yavapai, like, what have they been doing if they can't get a hold of the other ones, or if they're not responsive? And also, like, what if their loved one has passed? How do we navigate that? I mean, that whole process of trying to ask them a question of when they're giving, but their loved one has recently passed.
Good question, Alex. Leanne and Mandy or Rachel, do either of you want to talk about how you've done it?
Hi, Alex. This is Mandy from La Paz. Yeah, so we did our follow-up survey. We just completed it last week or the week before. We called all of our participants. We were actually just cold calling people. We just would randomly, call them, and if they didn't answer, we just left them a voicemail. All of our participants were very good at getting back to us. So either they answered right there on the spot, and we asked them, is now a good time to talk? Can we ask you a few questions? And they either said yes, or they gave us a day and time that would work for them, and we just called them back on that day and time. So that was relatively easy for us. We didn't have anybody like not replying or answering the phone for us. They were all pretty open to that. As far as having a loved one pass, we haven't encountered anything like that as of yet. So I don't know. Do you have anything to add to that, Leanne?
No, I mean, we definitely were able to visit with our people, and that was cool. I felt like it was a connection with them. It was another opportunity to talk to them about resources and kind of what's going on. I mean, with them really being isolated now. So
it was definitely a good follow-up, because we got to talk with them about like how they're doing, how they're feeling, and they're pretty open with us. Like, it's been rough because we're isolated, but at the same time, I've got to spend more time with my loved one or whatever, so it was kind of nice just catching up with them for sure. But we haven't really experienced that quite yet. So I'm not sure any advice on that.
Thank you, Mandy. I'll try the cold calling.
On someone's loved one passing away, just a suggestion, and I would like to get some feedback from you if you think this may not work for you, perhaps if grieving and dealing with loss is an issue that any of you have difficulty with. That's understandable. Just to share a story with you, I remember I was a resident on call. This is many years ago. I think it was but 20 years ago. So I'm dating myself. The attending one of the patients who was just admitted within the hour collapsed in the restroom with a massive coronary, and my attending said, "You need to go tell the family what happened." And I had not had any training or any exposure in terms of how to communicate that with someone who has just lost a loved one, let alone within an hour from the admission. So it's very difficult unless we've been given some guidelines and have some tools to address that. So perhaps that's one thing that we can talk about on one of our learning community webinars. But I also wanted to offer, if you call someone who has lost a loved one due to dementia or Alzheimer's, they have been caregivers and they're still experiencing that loss. During the person's course of disease, they were experiencing ambiguous loss. Now that's compounded by having actually lost the person, the loved one. But they still need resources and support. I wonder if they share that with you. First of all, I think that's a privilege when somebody shares that story with us and their experience with us. But we could still ask them if they need resources and connect them with services in the community. That's just the thought. I don't know what your thoughts are. I'm open to the learning community webinar and discussion. So I learn from you as much as hopefully you learn from other colleagues and partners here.
This is Rachel. Alex, I think that's a good question. And we actually, when we were reaching out to our participants, and we had a smaller group just to see if they would be willing to do the follow-up survey, we actually had 2 of our participants that their family member passed away. One of them we had connected with through email, and so it was a little bit more challenging getting in touch with her, but we did send her a card and letting her know just that we were there if she needed any support. But she also mentioned that she was getting some resources and support from outside sources and friends and family members. And for the other person whose loved one passed away, we actually heard about it from one of the other participants who was pretty close to her. And that participant has since moved out of Yavapai County and lives in a different state and is closer to family. And it sounds like she's doing well and enjoying being close to family and having them there for that support. But I agree, it was kind of difficult and challenging, especially with everything else that's going on with the pandemic, with some of the protesters. So we had reached out. Our 3 months would have been in December, and so we were a bit late in getting our 6-month follow-up together, but we did hear from a couple of the participants who filled out the survey and sent it in. They reached back out to us and let us know that some of the questions that were being asked might be skewed just because of the pandemic and things that were going on in the nation currently. Some of the questions were asking about in the past month: have you been upset because of something that happened unexpectedly, or have you felt that you weren't able to control the important things in your life? And so they just wanted me to know that that their responses would probably be skewed as compared to maybe different circumstances at different times. So I think that's something to be aware of as we review and look at those results from their responses too.
Yeah, that's a really good point, Rachel, and that's something I'll definitely make a note of as I kind of, do my report out on this. That definitely, with all of us and all the participants, current events are going to impact some of those responses for sure. Thank you. To, all 3 or 4 of you, was the format okay? Did it go smoothly to enter the data into the SurveyMonkey? And maybe about, on average, for those of you who did calls, it sounds like some of you maybe did it email, but for those of you who did calls with participants, about how long on average did each take, just so other counties can kind of have that in their mind of what to plan on as far as, time to commit to this.
Thank you, Rachel and Mandy, so for the surveys that I did, it took about maybe 10 to 15 minutes. It wasn't that long. I did have some, not concerns, but just comments from a couple of them that they wish the survey would have pertained more to the program itself, because they really, really enjoyed it and they just really wanted to provide feedback about how great it was and how much they enjoyed it and how much it helped them. And then they just felt that the questions were just not portraying the program itself. But they still completed it. They were very receptive to the couple ones that I've talked to, but it didn't take that long. And they all really loved the program, so they were really receptive to taking the survey as well.
Okay, great. Thank you. That's good feedback. So more questions about like what they liked about the program. Is that what you think?
Yes.
Okay.
And then Tracy, I also thought that it might be nice as well, because for people who haven't done this survey yet, it might be nice for them to get just a copy of the questions so they know what questions they're asking ahead of time. Because like in SurveyMonkey, you can't just go look at the questions unless you're filling it out. And obviously we don't want to fill it out because we would be giving you incorrect data that would skew the data. So if there would be a way for you to like send out the questions so that way like people know what questions they're asking before they actually call the participants and they can brush up on it, I think that might be nice as well, because our first call we had no idea what kind of questions or even how many, because our first phone call he's like, well, how many questions is it? And we're like, I'm not quite sure.
We chose. This is Leanne. I have an aunt that has dementia, so it was my father was in the class, and so we called him first because we just wanted, somebody that I felt comfortable with. Where we did it. So yeah, that would be a great thing.
And then also another thing to definitely make note of too is when we are calling people for this survey, we kind of need to make sure that they are not by their loved one, because we ran into that issue on one of our phone calls. His wife was sitting right next to him while he was answering these questions. And so she kind of picked up on it and she's like, okay, well, I'm going to leave the room so you can speak freely. But that's something that we didn't even really think about, is if their loved one's sitting next to them, they're not necessarily going to speak freely. So that's just another thing that we kind of encountered when we were doing the survey.
Okay, yeah, good tips. As far as the actual questions that I should have sent that out to you ladies just because your survey was a little different. So the follow-up survey that everybody else will be doing from here on out, and you all too for your future classes will use, is in the evaluation plan that we sent out, but I think it's a great idea for me to send that as a standalone PDF along with that new SurveyMonkey link once you all get to, the next round of classes and doing those follow-ups. So thank you for that suggestion.
That would be great. Thank you, Tracy.
Okay, good. Well, those are all good things. Please, if you think of anything else, please, feel free to email me that feedback. That's really helpful. And now we're getting towards the end, but before we let you all go, we wanted to talk about next month's learning community. So as I said, we have been thinking about kind of alternating every other month. So doing a professional development type topic one month and then one of these kind of check-ins the following month and going back and forth with that. So we wanted to get some ideas of what types of topics would be helpful for you all to address on these learning community webinars. So we're specifically looking for one for next month, but we'll keep a running list as well that we can hopefully get to over the coming year. And we talked about one idea already about how to respond to someone who's lost their loved one. Are there any other ideas of topics that would be useful for you all?
I think that maybe if we're gonna try to start switching over to a virtual platform with the classes, possibly having like a quick like crash course on how to use like Zoom and what the benefits are using Zoom over like Google Meet, over WebEx, something like that. So when it comes time, maybe in like October, like you were saying, if we do get the option to do virtual, we'll know which platform we want to use and how to use it correctly and most efficiently for our elder population.
Mm-hmm. Yeah, good idea. Thank you. Okay, any others? Okay, well, that's everybody's homework then. To think about it and think what would be helpful to you as you work on this program and prepare. It could be things related to the actual program, or it could be things more general about dementia. So if you could think about that and let us know. Feel free to email me any ideas you have, because like I said, I'll just be having kind of a running list that we can, go back to as we're planning future month webinars. So with that, that's about all I had. Does anybody else have anything else to add today?
Well, this is Babak. Do we want to find out from those who have joined us today? Would you like to have a learning community webinar next month, or do you want to defer till and postpone till the following month? What would you like to do? Or if you asked that, Ms. Leonards, sorry if I missed it.
No, I didn't ask. I think that virtual platform one would be a great one. I'm not sure we'll be quite ready for that by July. Even knowing, I think it'll take some research and some brainstorming with Duet about what platform might be recommended. And so I think that is a really good idea, but maybe better for later in like maybe August.
And as far as platforms, also I had mentioned in your the feedback in your Q3 report, please look at what your agency has, what they have budgeted for. Do they already use a certain platform? That it's going to be very community centric and specific. So one of the things that I would ask you is to send myself and Ms. Leonard an email letting us know what platform you're currently using, or perhaps your agency leadership is planning to subscribe to and use. Then we can take a look at who's using what, and we'll have to find somebody who's tech savvy to present that, or provide you with the information that you're requesting that Mandy suggested.
Hi, this is Leanne. I'm thinking that next time we meet, that having something for us about grief. So kind of going off of what Babak was talking about, maybe reaching out to hospice. We can do that individually, but to have something that would kind of get us all up to speed and really how to deal with the passing of a loved one.
Okay, thank you. And I think we could work on that for sure. I can coordinate with Duet too and see if they have any ideas of maybe even some guest speakers that we could have join us on our webinar and address that.
This is Anne. I think it's an excellent topic, and we can help definitely plan that, because one of the things we know, and it would be important to get the right speaker on this, is that the transition from complex grief to a more simple grief, which is a more clear-cut grief, is very different than just dealing directly with a clear grief. And it's that transition that is very, very difficult for someone who's been experiencing ambiguous loss. They tend to not fit in well with a traditional grief support group, and there's reasons for that. So I think it's an excellent topic, and one where we would really be talking about that transition, because of the fact that these are folks who have been caring for someone with dementia. Does that sound good to folks? We'll assume so.
Yes, yes,
We
that sounds
have
good.
dealt with that, and I think we could come up with some good presenters.
So
Very
That
good.
sounds great.
Ms. Weed, since I think Ms. Leonard is going to be is not going to be available in July, is that right, Ms. Leonard?
Well, just not the third week. I think we can figure something out offline as far as either holding it like maybe the second week of July, or you all can carry on without me if it's the third week of July.
Okay, so either way, let's if we can do some discussion planning offline, that would be great.
Yeah, and we'll get you all a calendar appointment for that soon then, once we get the date and time confirmed. And I think that this platform is working fine so far, so we'll keep going with Google Meet. And like I said, this has been recorded, so I will send out the recording link and the minutes from today, so anybody who wasn't able to join will be able to see what we discussed. With that, unless anybody else has anything else, I'll let you all get on since it's almost 10 o'clock. Thank you so much for joining us today. Anything else from anybody?
Thank you, everyone.
Thank you.
Stay safe and healthy.
Thank you, everybody. Have a good day.